Rocking and rolling, I'm back. The caller is so patiently waiting, he called back. Let's see what we can do. What did we forget, my friend?
And Michael, the name of the business is?
Named after my beautiful mother, Geraldine S. Regan. It's G.S. Regan. G.S. Regan Associates Incorporated.
R-E-G-A-N?
That's perfect. Good Irish name. G.S. Regan. R-E-G-A-N.
Okay, and then I'm going to leave this on his message. They're busy with a family situation today, but just let me have the number again here. I'm not sure. Is it the last four digits?
Let me give it to you nice and slowly.
6099?
G.S. Regan Associates, Inc. 203-757-6099.
Oh, I did have it correct. Okay.
You're a good man. Have a good one. Talk to you later.
I'm going to tell you, I'm going to have him say Charlie sent me. Give him a discount, right?
Oh, absolutely.
I'm
Charlie.
only kidding, but no, you'll love this couple. They're a very religious couple. They're both Eucharist servers, but don't say anything more than that. But
you hear me say God bless all the time. My dad's a Eucharistic minister, and my full name is Michael Patrick Aloysius Regan.
God bless you. You're a beautiful-looking couple, and I was so happy to hear you have twins. So God.
That's all my wife. She's the good-looking one out of the couple.
God be with you and your family.
You too.
Thank you,
God bless.
Michael.
Talk to you later, Charlie. Thanks for listening. Oh, what's going on here? Pop it. Pop the head. All right, let's get down to business here. So, HR directors out there that are listening, especially my friends at Carmody and Torrance Law Firm. There's a lovely lady who always says she listens. If your firm doesn't offer domestic partner, it is free. It is not a charge. Axe grinders out there are going to hate me for this, but you know what? It doesn't matter to me. As long as you have love in your heart and you want to be together partners, whether it be male, female, and they're hippies and they just don't want to get married. But people get cancer, okay? I'm dealing with a woman with a double mastectomy right now. So don't come down clogging up the lines. Call Larry about that stuff. Domestic partner, it is legal and it's upon renewal. So talk to your insurance agent out there. If I'm not one of your agents, you should at least give me a shot. The exchange, the notice, N-O-T-I-C-E, the exchange notice is mandatory by October 1st, 2013. You employers out there, all you're hearing is over 50, and you're saying, well, I'm in the clear. Just take a proactive approach and just get the notice. I can email you one. Kristen worked on that all morning. She should have it by now. Get the notice to your employees. Let them know that there's going to be a Connecticut insurance exchange. You've heard the show. The name is called Access Health CT. All right, so just get it. The Department of Labor has it on their website, but it was a little hard to find, the dolct.gov. But it is mandatory. Now, for those of you who don't want to take it seriously, it's $100 a day per employee fine that you do not distribute this. All right. The exchange is going to offer subsidies. A family of four making $92,000 a year. And that is a ton of money, by the way, living in Connecticut. But anyway, if you're a family of four and your income is $92,000 or under, you will qualify for a small subsidy on the exchange. The exchange, as you know, is going to have platinum, gold, silver, bronze. Boom. All right. Husky. The program for Husky out there, if you grandmothers or grandfathers have any children who, in this economy, there's going to be some big layoffs. Waterbury Hospital is going to have one. St. Mary's Hospital is going to have one. I read the sad article about Darlene Stromstead and Chad Wabel in the paper. And it looks like the state is going to withhold money, rely on Obamacare somehow. I don't know where all this money is going to come from. But anyway, they aren't getting the subsidy from the state that they thought, so they may have to have massive layoffs. Husky and your children are getting laid off, my listeners out there, good time oldies. Just simply have them call the office, or they can call the Stay Well Center. The Stay Well Center is always willing to help, even if they don't have insurance and can't afford the COBRA. They can go there, which I admire. You doctors out there, with the Husky program, yes, you're going to get paid a little bit less, but I am hearing some nice favorable things that you're saying, well, if they're an existing patient, we will take them. So rest assured, if it does happen, anyone gets laid off from your firm, we can try to help you. Do we get commission from the Husky? No. But is it the right thing to do? Yes, because healthcare is important. People get sick. All right. Another thing for you HR directors out there. Upon renewal, you should be asking questions, getting ready for a rate increase. Anthem, Blue Cross Blue Shield, and Aetna are the only two carriers doing this. What they are doing upon your small group renewal, and a good buddy of mine, Sandy, and I have been talking daily, her renewal is coming up in August. So to be proactive, we start literally June 1st. And what she and I are both in compliance with is that we know that said carrier, whether it be one of those two names I just said, the rates are going to be good through December of 2014. And HR people, if you don't know this, give us a call in, and we can thoroughly explain this to you. So this started in April. The carriers have held second quarter rates, and they're letting you, as the group, renew. Anyone under 50 is considered small group, and that's 50 full and part-time employees. They're letting you renew through 12/1/2014. All right, enough HR directors. For you seniors out there that may want to retire, you're doing well. Your kids are grown and you're 62. There is a provision which a good friend of mine, Dr. So-and-so, did not know it existed and was given misinformation. So he listens to the show, or one of his staff listens to the show. He calls me up and asks a question. I say, no. There's a provision that Commissioner Susan Cogswell, she passed away, she's from Torrington, great lady. She was the Department of Insurance Commissioner, and we, my CBB, Connecticut Benefit Brokers, and I helped write this. Actually, I helped write it for my beautiful mom, Jerry, but we all had a stake in this bill. It's called 03-77. Now, a listener about 2 months back heard me, and beautiful woman was with a surgical center that merged with another facility, and said, well, I should be eligible for this. Yes, certain self-funded organizations can carve this option out. So it's a Connecticut General State Statute 03-77 COBRA continuation. But if they chose to carve it out in their charter when they wrote the plan with the carrier, I'm sorry, I'm not perfect, I'm only human, and that might be something that the plan didn't put in. So this is just, I'm trying to get this over the airways, just general information. Grandfathering in. People ask me that all the time now. HR people out there, what's that mean? You should know. Do not pierce your plan. If you drop your plan, go to the exchange, have everyone buy from the exchange, and then if you don't like that plan or the subsidy didn't pan out, you cannot go back to your existing plan. You lost your grandfathered in status. So everyone always hates healthcare. They say to me, I hate this. I barely like you. It's a necessity. You need care. If you look at the cost of claims compared to the cost of your premium, you will see that you will not be able to save enough money to self-fund a lifetime of claims, especially you employers out there who have employees. One tip is to have some of the employees that work 20, 25 hours. Look at individual plans. As of September 9th, 2012 or 11, producer Tom, Google that. September 2011 or 12, Obamacare kicks in 20 hours. I believe it's September 19th, 2012. But I'm pretty sure it is, but producer Tom's good with that. Yep. Quick search. The administration said that now it's eligible, you are eligible, it's not mandatory, but it's eligible to include employees on your medical plan that work 20 hours or more. So, Tom, you're going to put in 20 hours or more, September, Obama administration, eligible for medical or something like that. But off the top of my head, because I don't have the computer in front of me, I've got to be a computer. I'm pretty sure I'm correct with that. In 2011 or 2012, most likely 12, the administration, the current government administration in now, allowed the employer, if they choose, to include hourly employees 20 or more. It was always notoriously 30. So you need to make sure and check with Chuck Stoller on this, or my buddy Vincent, or Mark Williams, or actually probably Julia Brown. I should do this now, this plug for her. Frank Morrow and Larry Rifkin, my buddies, asked me to read this, and this is right up my alley, and I was just there yesterday, so I will read this. June 26th, this evening, the Village at East Farms is pleased to announce attorney Julia Brown will be available to highlight the many legal and financial issues that occur when medical conditions, disability, aging of family members becomes paramount in someone's life. This session will be tonight, Wednesday the 26th, at 5 p.m. at the Village. For more information, call Randy Belmar, 203-757-7660. And if I read that too fast, you could just call in and I'll have one of the producers get you the information. But I know Randy, hard worker, very intelligent woman, and I've met Julia Brown. She and I talked about 12 years ago, and she was always super intelligent, so she's obviously going to be a good advocate for you to listen to. And basically what that is saying is that it's for senior care, for elder care. She definitely is an intelligent woman, so you might want to go with that. It's going to talk about activities of daily living, ways to spend thrift down. A good friend of mine's mom has become ill, and she qualified for some subsidies. And to get down to indigent level, you need to be under $1,681 of poverty level. You can own a few things, but not a lot. There is a look-back period of 60 months. There's things to do to get things out of your name. Disabilities, obviously, the friend I visited at the Village yesterday broke a hip. Legal and financial issues, those things come up. You know, it's something that you should be considering. So go see her tonight if you want. As far as what we were talking about, the eligibility requirements under health care reform, not Obamacare, Affordable Care Act, PPACA, state that an eligible employee is 30 hours or more, full or part-time. So if you're over 50, it's mandatory. You better be ready for this, and your HR department better be ready for this. If you're under 50 and you're just tiptoeing on the line, please feel free to call me. I'll let you know what that is doing. All right. My first appointment of the day, my 8:30 appointment this morning, a woman I know well for years. She works at a facility where people go in to get medicine dispensed. I can't even tell you anything more than that because I just don't want to. Anyway, she's one of the greeters at a pharmaceutical facility, and she told me that she got burned for more than $250. People out there, I've talked about this all the time. My buddy at the YMCA years ago, stay the course. He hears me saying it. Apparently not enough people are hearing me say it. The physicians get paid from the insurance carriers. They too need to work. They too have mortgages. They too have a lot of overhead, malpractice. So coding, C-O-D-I-N-G, CPT coding, or the new coding is IDC-10 or ICD-10. I'm not a coding expert. I'm an insurance agent. But there will be a new coding system established. The woman went in for a regular gynecological visit. She said, I'm doing great. I'm here for my regular routine pap and pelvic exam. I know the gynecologist. She's very intelligent. And she says to her, great, you look great. Everything's in order here. Is there anything you have any pains? She said, once in a while I get a shooting pain here, but it doesn't bother me other than just occurs a few times a year. She says, we should get an MRI. Not even thinking, or an ultrasound or some diagnostic test, not even thinking. The coding now loses the V code. V for victory for use because it's coded for free, loses the V code. She gets billed a copay on her insurance, and the diagnostic test and blood lab and everything cost her $250. So please watch out for yourselves out there. You need to ask questions all the time. One proactive approach I've been taking lately is tell the doctor in advance, call the office. Hopefully you're always polite to your people there because they are the ones who are helping you. So show some manners. Hi, Susie. Hi, so-and-so. Hi, Claire. Hi, so. I'm coming for my wellness exam. My plan is United Healthcare. I have wellness included with it. My plan is Anthem. I have wellness included. My plan is Connecticut. My plan is Aetna. If I forgot a name, Oxford. You tell them the name of your medical carrier. You tell them as of January 1st, 2013, colonoscopies are now covered as wellness, as long as they're CPT coded for wellness. My buddies at the Surgery Center always tell me the proper coding for that one. If you have a polyp and it's possibly cancer, you should not worry about paying $500. They saved you from cancer. But if it legitimately is a wellness, you need to ask it for wellness. All right? Now, there's only 20 minutes left. I'm going to talk for 10 minutes, and then I really want producer Nick to plug it because he actually got in the newspaper. So what we're going to do now is we're going to open the phone lines. Anyone going on vacation and you want to know the proper ways to take care of yourself on vacation, the lines are open. If I don't get any calls, I'll just keep talking because I already know the answers. 203-757-1320. You are on a Medicare supplement. You and your honey want to go to England for the summer. You want to go to France. You want to go, as the woman said this morning, Italy. So, all right, I'll take the call. Maybe it's pertinent. Michael Regan, how can I help you?
One of your number one listeners.
Andrew!
Hey, my brother Michael, MR means mighty reasonable.
You're good, man. Hey, you taking any vacations this summer?
No, because I'll miss you.
All right, well, that's awfully nice.
And
all
I
right.
don't have a computer because I'm still learning how to dial the phone.
No, you do it well, and you're consistent. We love that you're part of the show.
And I'm going to tell you something. My friend Chuck there, he called in. He's always trying to help somebody. And I'll tell you, he does a great job. And I'm going to tell you something. The people I had you help, or not had you help, but you helped, and the numbers you gave me for that medical savings plan, again, I want to put another feather in your hat. You're going to look like an Indian after all the feathers I give you.
All right.
I just want to say.
Hold on, because I have one of my topics for you. I didn't know you were going to call in, but I hoped you did. That Silver Connect card that I got you.
Yes.
Is the first three numbers 003 or 002?
002.
Okay. You can head down. You now have dental insurance.
Oh, no, I know that because when you had that lady on at Staywell.
Yes.
I do all my business there with the dental, with the medical.
My buddy's
everything.
mom is going to get dental. And people don't realize that. They are getting paid. They are. The government, because it's a form of Medicaid,
yes.
It's not full-blown Title 19, but it's a low-income subsidy, so nothing to be ashamed of. All it does is it reimburses you the $104.90, which is your Part B premium, and it gives you pharmaceutical assistance if you take prescriptions, usually $2.60 and $6.50.
Well, I'm on that WellCare. So
right.
It doesn't cost me anything.
Right. Zero, but that's a Medicare Advantage plan, don't forget.
Yes.
Now, people always ask me that. They say, well, aren't I good with just Medicare and this Silver card? No. The Silver card needs someone to bill. They need someone to pay. So, if WellCare messes up their plan from October to December, you and I will talk over the airways and we'll decide what you're going to keep. It's still good. And by the way, don't forget to take advantage of the WellCare. They have the assisted doctor visit program where they'll pick you up at your house and take you there. You know that, right?
Oh, yes, because I have logistic care when I need a ride. I got to go in for surgery July 10th.
This guy is a smart guy.
I have a torn eye retina, so it's all ruptured in the left eye. But
is it all right?
But the thing of it is, I want to do this for you. And to all the people who are listening, listen. There's the greatest hug from God and me to Michael Regan and all the people he helps. And the ones that need to call him, do that, because I'll tell you, he's right there.
All right.
His mother gave a good thing to this world.
And my dad. All right,
And
so
your dad, I'm sorry, forget me.
no, you got to put the Lord first. They taught me you got to go to church, you got to shake hands, got to hold the door for a lady, you got to be polite, do not steal. Don't worry about money. Money just gets greedy and you can't see. You're blinded. You got to just be good and things happen. So, all right, we're going to go back to the topic. We'll talk to you in 2 weeks, Andy. Have a good one.
Bye.
All right. Vacationers out there. Maybe Andy's not taking a vacation, but hopefully you are going to. So, I don't sell WellCare. It's not in my feather, in my cap, but I do like the headdress he just gave me. It looks good on me. And I love Indians, too. That's hot. I could be like Tonto or something like that. Okay, so back to vacations. For you that are out there, my good time oldies listeners, if you have a Medicare Advantage plan, which means it's either slow premium like $34 or zero, if you have an Advantage plan, worldwide coverage are most of them. Connecticut offers a plan with about a $50,000 per year cap. But Aetna, Anthem, United Healthcare, they all have worldwide coverage. All you do is you go to the emergency bullet number 17 or 16 in your book of description of benefits, which you should have. And for United Healthcare, I was just informed by the intelligent Jean Diversa Gomes today, you do not call and put yourself on the passport program if you're going out of the country. It's only traveling within the country. So great job there, bud. So if you're traveling within the country and you have United Healthcare, put yourself on the passport program. If you have Anthem, Aetna actually has 16 states. So United has 24, Aetna has 16. Take that caller, and I'll wrap the vacation stuff up, and then we'll let producer Nick plug. Michael Regan, thank you for calling.
Hi. Michael, what was the numbers again? Did I hear you right that a Connect card qualifies one for dental?
Yes, absolutely.
But what were the prefix numbers?
The first three numbers, I'm learning this as I go because it's not a commissionable product. I like to help people, but I still have to put food on the table. It's 003 or an 002 at the beginning of your number.
Yeah.
You have that?
Yep.
Okay, call the brilliant Daryl Willenbrock and the Agency on Aging, Carla Maselli, Dick Wood, Heather. They're all fantastic over there. Are you a client of mine?
No.
Okay, so yeah, you can call the office, but it's harder because I don't have a file for you, so I'm not that HIPAA compliant with non-clients. So you can call Daryl Willenbrock, Agency on Aging, at 203-757-5449. If you have the Medicare Savings Program, depending on what level of QMB, SLMB, Q03, or just LIS, you qualify for dental. You can use the Staywell Center. You can use Dr. Tulasi Vikram. She has the Connecticut Family Dentistry. They have a shuttle bus even. I just gave a client a referral there today. Her husband, Amit, is a good friend of mine. They can pick you up at the house, bring you. They're 100% compliant, all American Dental Association board certified. You can use 1302 South Main Street. You could use your dentist, but do not go to the dentist and just show the card. Call the dentist first and say, do you take this silver card? If they don't, well then free dental sometimes is nice. You get 2 free cleanings a year with it, and you get the work done and paid for, by the way. Paid for. I've watched it happen right in front of my eyes. So what you do is you call 203-757-5449 and you ask, what level am I at? I listen to Michael Regan. He plugs you all the time. And they will tell you, don't say your name on the air for HIPAA reasons. They will tell you if you qualify for the dental. If the answer is yes, you call back in 2 weeks like my buddy Andy did and just say, yeehaw, and you go get your cleanings done and you get your work done. It's covered 100% by the government.
Okay. Too good to be true.
No,
okay.
It's not. It's not too good to be true. Nobody does this. This is why producer Tom, producer Nick, and I, we do this. We want to help people. There's so much garbage out there. Nobody actually says, here's what you can do, and there's no charge for this. You know, it's available for you out there. You might as well know it and take advantage of it, right?
Okay.
All right, we'll talk to you in 2 weeks.
Thanks.
My pleasure. Thanks so much for calling. Let's take a commercial break. I'll let producer Nick in here next. See you in a few minutes, my listeners. Thank you.